On to the latest surrounding coronavirus, and rather a hiccup, in fact, for the plans for coronavirus vaccinations in Japan. The first round of just a few jabs there are due to get underway next week, but already rather a complication. We're going to talk to our correspondent, Justin McCurry, who joins us now from Tokyo. Justin, explain to us then exactly what this problem is, can you?
Well, this all comes down to the size of the syringes that are going to be used to administer vaccines here in Japan, as you say, starting from next week. Specifically, the Pfizer vaccine. If you look, this isn't really entirely Japan's fault. If you look at the vials of the Pfizer vaccines, it does say that there are 5 doses inside each vial. But in countries that have already started their vaccination rollouts, it was noticed that you could actually get a 6th and final dose out of each vial. And given the huge numbers of people involved in this global vaccination program and, of course, problems with supply, it makes sense to squeeze every last drop out of vaccine out of each vial. But the problem here in Japan is that you need specialist syringes to extract that 6th dose of vaccine. And most Japanese health facilities use standard syringes, standard needles. So what's going to happen once the rollout of the Pfizer vaccine begins in Japan is that health workers are simply going to have to throw away that 6th and final dose. When you think of the number of people, 126 million people in Japan, not all of them will be vaccinated, only those over 16, but it will mean having to throw away millions of doses of the coronavirus vaccine.
Just because they're not long enough. What about the actual plans then, Justin, to get the inoculations underway there?
Well, this has also been a hiccup. Japan has been criticised for lagging behind other countries by several weeks, actually, in some cases, several months in beginning its vaccination program. One of the reasons that health officials here give is that the number of deaths and cases in Japan is relatively low, particularly when you compare them to countries in Europe and the United States. But the vaccine rollout will begin next week. It'll start with a relatively small number of people, up to about 20,000 frontline health workers. They're expected to receive the Pfizer vaccine from the middle of next week. They will be monitored. Their health will be monitored every day up until 4 weeks after they've received their second jab. So it's quite a long and drawn out process, but the Japanese health authorities are very keen to see whether there are, in fact, any side effects associated with the vaccine. They'll then move on to about 8 million other health workers, 36 million Japanese aged over 65, people who have pre-existing health conditions and other vulnerable groups. Now, significantly, the general population, if you could call them that, people aged between 16 and 59, aren't due to receive their first jab until sometime in July. And of course, that's when Japan hopes, and I stress the word hopes, to host the delayed Tokyo 2020 Olympics.
We shall see. Justin, thanks very much. Justin McCurry, correspondent, talking to us there from Tokyo.